republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, everyone. This is the regular scheduled Board of Public Works and Safety meeting for Wednesday, November 5th. Can I get a roll call of members, please?
Mayor Land,
Here.
Betsy Barnes,
Here.
Bob Clemens,
Here.
Jim Crook, and Billy Gomez.
Present.
All present.
Full form. First on the agenda is the approval of minutes of the prior meeting, which was held on Wednesday, October 15th. A motion to approve the minutes and a second. Any further discussion on the motion? Hearing none, all in favor signify with an eye.
Aye.
Opposed? Passes. No addition of new items today, so we'll jump down to number one of our old and deferred business with our utility updates from Al. Good morning.
Morning. A lot of paperwork items to address today. We'll start off with our phase 1 water, or our phase 4 water project. This project, we've issued several change orders to utilize remaining funds. With the project, we were waiting until the contractor completed all this work to identify the outstanding amount within the loan. Now that it's been identified, we're proposing an amendment to our water master plan contract. That water master plan was assembled. All 4 phases of work were completed. We've realized the growth that we identified in the master plan, and our service areas changed. So we need to update the model, update the master plan, identify what the needs are for the next 20 years. So in front of you, you have 3 reimbursements from the SRF loan. It's reimbursement number 39, $1,059, reimbursement number 40, or disbursement number 40, $3,508, and disbursement number 2, INT, at $18,238. I'd like to request the board's permission for the mayor to execute those SRF disbursement forms.
Okay, thanks, Al. So these are, all 3 of them are related to the
4-phase project with water.
Okay.
One motion?
Can we do all 3 in one motion? Yes, one motion would be good.
One motion. So move, Mayor, on that as presented.
Okay. We have a motion to approve the disbursements as presented. We have a second. Second. And a second. Any further discussion on the motion? Hearing none, all in favor signify with an eye. Aye. Opposed? Passes.
Thank you. Second item under this category is Commonwealth's amendment for the 2025 Water Master Plan update. It's CEI Task Order 2025-07. Reallocates remaining funds for purposes of updating your master plan to be accessed on an hourly as needed basis. So I'd like your permission for the mayor to execute that task order.
Okay, thanks, Al. So I'm assuming typical with all master plans for everything under the city's umbrella, it's a living document, right? So as the community changes, or it's always being updated or.
Absolutely. One example is our growth projections. So under the prior master plan, the growth projections were identified, and over the last 10 years, they were dramatically exceeded. So
yeah,
things change.
Okay. Okay, thanks. I'll bring this on to the board.
So move, Mayor.
Motion to approve the update master plan. As the
Yes.
stated. And we have a second. And a second. Any further discussion on the motion? Hearing none, all in favor signify with an eye.
Aye.
Opposed? Motion passes.
Okay, thank you. Second item under water is our new 24-inch water supply line. Our design is complete, less the need to incorporate actual survey data. We use what's called LiDAR. That's available contour information that the state provides, but you need to go out and physically survey to make sure that you get the contours correct. And you need to have the geotechnical engineer go out and punch soil borings. So those two items, we were waiting for the crops to be harvested. Beginning of this week, we were notified all the crops were out of the fields. And so our surveyors will be mobilizing to gather that information. The geotech will be mobilizing to obtain the soils information, and we'll incorporate that in our bid documents. Any question on that water supply line project?
Oh, are we on schedule? Are we gonna finish what we're doing this year by the end of the year?
We are on schedule to bid this project. It's going to be funded under the January through March. I think it's called the second quarter with SRF. But between January and March, that's when the funding will be allocated for this project and our wastewater treatment plant project.
Okay,
We need to receive the closing date from SRF, but our project will be bid and ready to be processed by that time.
Because I think we're still, correct me if I'm wrong, we're still looking to have this out to bid middle of this month.
We are, yes.
thanks, Mayor.
Thanks.
Lead service line replacement project. So this is an ongoing endeavor on the part of the city. We have incorporated 3 phases as needed of these projects with the financing packages available. First phase is under construction. That phase of the project, we have almost completed all contractual work within the phase. We have funds remaining, so we're going to expand the scope, award 2 additional locations and some other areas that the city's identified. The intent is to fully utilize the funds available. There's $5 million from the state. We fully utilize those funds to replace as many lead service lines as possible. So today I have Gatlin Pay application number 3. It's in the amount of $391,091.25. And the SRF loan disbursement number is 13. So I'd like your permission to execute payment to the contractor and solicit reimbursement through the SRF.
So, bring this to the board and for action questions.
And what's your opinion on that, Mayor? We're in full compliance, aren't we?
Yeah, I mean, we've made great progress. It was a long journey getting started, but as I said, we're in a position now where we can do some alternate sites as well that weren't included in the very first initial phases.
So move on that, Mayor, as presented.
We have a motion to approve the disbursement number 13. We have a second
I'll second.
and a second. Any further discussion on the motion? Hearing none, all in favor signify with an eye.
Aye.
Opposed? Motion passes.
Thank you. We also have engineering invoices that total $35,381 on the same project. And that would be reimbursed through disbursement number 12 through the state revolving loan fund. So I'd request your permission for the mayor to sign that disbursement request form.
Okay, thanks, Al. So we'll bring it to the board then for action on disbursement number 12.
So move.
Motion, motion to approve and a second. Any further discussion on the motion? Hearing none, all in favor signify with an eye.
Aye.
Opposed? Motion passes.
Thank you. Last item is a task order. By adding the additional work, we'll be extending the contractual time frame. We have funds remaining within that contract under other hourly as needed items. So I'm looking to move those funds over to construction engineering services. So it is a $0 task order 2025-06 for reallocation of funds. I'd like your permission for the mayor to execute that $0 task order.
Okay, so bring this to the board then as well.
So move, Mayor.
Okay, so I have a motion to approve the request, the task order 06. We have a second. And a second. Any further discussion on the motion? Hearing none, all in favor signify with an eye.
Aye.
Opposed? Passes.
Thank you. Next item is our phase 2 lead service line project. So we did receive the $5 million funding from State Revolving Loan Fund. And every year we're required to notify all homeowners that are on our lead service line industry inventory. Currently, we have about 2,500 homes on that lead service line inventory. So those 2,500 homes receive a letter indicating you may have lead pipes and these are the health ramifications. The first round of work was to address these acute areas of concern. Phase 2 work is to fully characterize what's remaining. So we have these 2,500 homes. Of those homes, several folks have already received notification, but were non-responsive. And we'll take those individuals off the list. And there'll be additional work that's going to be performed under phase 1. So we'll take those individuals off the list. The ones that remain, we need to go out to every single home, identify the meter location, trace the lines, identify the material type based on visual inspection, and then attempt to gain access to the homes for physical inspection. Once we do that, we'll know exactly how much work remains. We'll be able to fully utilize the phase 2 funding, and then we'll know what we need on the phase 3 borrowing. So we don't want to borrow the 5 million if we don't need the 5 million in phase 3. So this task order is larger than normal just because of the field work. So the field work for 2,500 give or take homes is extensive. And it constitutes over half of this contractual amount on an hourly as needed basis. The engineer task order is 2025-05. It's in the amount of $2,176,081. Essentially, we're doing all the work that needs to be done for this phase and for the upcoming phase 3, but doing it in phase 2. We talked with the city. The city's utility folks have been very helpful in reducing the amount of work, amount of efforts that we have to put forth. They're going to continue to do so. I budgeted as if we were doing everything. So whatever the city can help us with, we don't have to do, that dollar amount will go down. But I'm requesting that the CEI task order 2025-05 in the amount of $2,176,081 be executed today.
Question for Al.
Yeah, right.
Al, when you talk about dismissed, when those people didn't when you say dismissed, what does that mean?
Are you talking about the individuals that we
Yes.
notified? When we go through notifications, some people get irritated. So we have to, by the rules of the grant, we have to provide 4 means of notifications. So we put a advertisement in the paper, we mail them something, we put a door hanger on their door, and then those that don't respond, we try to make physical contact. Well, somewhere in that frame, you have a lot of individuals that say, just leave me alone, and they don't want to participate. So we have a form, we say, we'd like you to sign this, saying that you decline that. Sometimes they sign the form, sometimes they don't. But if we've already provided them notifications and they haven't been responsive, there's no reason for us to continue to go out and notify them this next time around. So even though they are on the lead service line inventory, we won't make an effort to contact them to collect their information. We'll just characterize the city side. And then if you have lead on the city side, we'll replace it and we'll provide them with a Brita filter. And we'll say, this, you had a chance. So.
The reason I asked that, Mayor, because if I ever get asked a question like that.
Yeah, suggest to them that when they're receiving notice to be responsive to it.
Yes.
That would be my
So
suggestion.
we're covered.
So we're covered.
Thank you, Al.
You're welcome.
Thank you,
Is
Mayor.
there with regard to the 5 million from the state, is there a sunset on that, like to be used by?
There is. This phase 1 needs to be utilized. 80% of the funds needs to be utilized by May in order for us to get phase 2 financing. So that's why we're increasing the scope of work on phase 1, instructing the contractor so that we can then obtain phase 2. Same thing, it'll have to be used by the next May to use phase 3. If it's not utilized by that time frame, then you're not eligible for the following phase financing. And there are only 3 years of this bill funding left. So we took advantage of this year, planning on taking advantage of next year, 2026. And then our phase 3 is last year, 2027.
Okay, that was gonna be is it the funds for phase 2 already, in phase 3, I guess, been appropriated at the state level, or is that still?
Well, they're through the federal level, so they have the funds. We've already received our notice of award.
Okay,
So we received 5 million, 0% loan, 35 years.
So you need a motion on this?
yeah, for the task order 05.
So move, Mayor, as presented.
We have a motion to approve. We have a second and a second. Any further discussion on the motion? Hearing none, all in favor, signify with an eye.
Aye.
Aye. Opposed? Motion passes.
Okay, thank you. On our existing treatment plant project, the only thing that hasn't been verified yet is that the controls are operational. We've had conversation with Chris Previs out at the treatment plant. He's agreed to allow us to fill his equalization pond so that we could simulate a storm event. We talked about potentially just simulating it from an electronic standpoint. It'd be much better to physically simulate it and see what the outcome is. When we fill the ponds, though, if you get a rain event, you'll have an overflow because you don't have ponds. So, it's pick your poison, but we think that it's prudent to fill it, to test it. If we get an overflow, we'll just notify the state it was due to testing of the wet weather system. So that's the latest update on your existing treatment plant. Downtown Interceptor, phase 1 is commenced. Adjacent to the plant, there's a long bore across Main Street. They're preparing to perform that bore and should be seeing some activity this week, if not next. We do have a invoice to submit. This is Commonwealth invoice reimbursement through disbursement number 13 on the order of $147,588. I'd like to request your permission for the mayor to sign disbursement number 13 for $147,588.
Before we jump on it, when it reaches a point about boring under North Main Street, is there any road closure or traffic that will be impacted? Or do they do that with the road?
I'll check and follow up with you on the treatment plant side. The bore pit is so far away, there's not going to be any impact. On the other side of Main Street, the bore pit is right at the intersection, so there most likely will be some flaggers.
Okay.
But I'll make sure that Terry is aware and can update everyone.
All right. Perfect. Thank you. Okay, so we'll bring the disbursement at the amount stated to the board.
So move, Mayor, as presented by.
Okay, we have a motion to approve. We have a second. And a second. Any further discussion on the motion? Hearing none, all in favor signify with an eye.
Aye.
Opposed? Motion passes.
Okay. The second one is much larger than you're used to seeing. These are invoices that date back to April of this year. So they're 6 months worth of invoices. And they're for services performed on the existing treatment plant, on the downtown interceptor, on the new treatment plant, and on the new lift stations and interceptor. So we were waiting for the loan to close. And once the loan closed on the downtown interceptor, then the city was able to pay these outstanding invoices. The SRF had characterized these funds only for the downtown interceptor. So we had to do some paperwork, get the mayor's signature so that he could utilize the funds not only for the downtown interceptor, but for these other projects as well. We received that permission. So we have 6 months of outstanding invoices that have all been brought to you before, have been approved, but I'd like to bring it in front of you now as a summary and obtain permission for the mayor to sign disbursement number 14 in the amount of $3,086,134. And again, all these have been approved. They just haven't been paid because we didn't have funds.
Thank think so. I mean, Al did a good job explaining it. That's why the number is so high. Is, they've already been approved, but we were waiting for the SRF funds to be available to make the payment all at one time.
I know you researched all down there. You want a motion on that?
Yes, sir.
So move, Mayor.
We have a motion to
Second.
approve disbursement number 14 in a second. Any further discussion on the motion? Hearing none, all in favor, signify with aye. Aye.
That Joey clears us up, Mayor, on that, those backups. That clears all up.
For the ones listed,
Yeah,
yes,
one's listed.
correct.
Okay.
Thank you. Last two items, Southeast Wastewater Treatment Plant, designs complete, going through the permitting process, anticipating bidding that next week. I'll be calling the SRF to identify our loan closing date and calling the permitting agencies. And I'll update utilities in the mayor's office if we're gonna delay a week or two based on permits. But either way, we'll get this thing out to bid this year. Collection system improvements. We continue to move forward with the Greenview Lift Station, Delaware Lift Station, and our 60-inch interceptor from 231 up to the treatment plant. That project will be complete, ready to be bid summer of 2026.
November 26th.
Summer of 2026, most likely June, July.
Any questions? All right, thanks, Al.
Thank
Appreciate
you.
it. Okay, first up under new business, request approval to hold Legion copy donation collection. Good morning. Can you give us your name and address?
My name is Allie Wayne. What else did you ask for?
Address?
1401 North Main Street.
Perfect. Welcome.
I'm here on behalf of the American Legion Auxiliary Unit 20 here in Crown Point. As I'm sure most of you are aware, the poppy symbolizes veterans and their service. And on Veterans Day, we would like to hand out poppies and collect donations on the corner of South and Main Street and Court and South Street.
9 to 4?
Yeah.
Okay. Because it's on Veterans Day and for the cause, do you have a rain date in case the weather's not conducive to
Nope.
that? Would you like?
Just Veterans Day.
Okay, all right. Okay, well, to me, this is a no-brainer, but I'll bring it back to the board for questions or action. A motion to approve the request. We have a second. Second, any further discussion on the motion? Hearing none, all in favor, signify with an aye.
Aye.
Opposed? Motion passes. You're all set.
Thank you.
See you on Veterans Day. Number 2, request approval of Roman Catholic Diocese of Gary dedication of right-of-way. Alex?
Thank you, Mayor. Follow up on Al's comments with the downtown interceptor. The diocese was a bit of a challenge. They have property that dates back to a transfer in the 1800s. And so we were able to easily find one where they gave us a warranty deed on the one parcel. And because of some future plans, they wanted to proceed with the dedication of it right away on the second parcel. We reviewed that with Al. The dedication is sufficient enough to pipes in the ground that it needs to. So we prepared this dedication. We pulled it right away. The Roman Catholic Diocese has signed it. So we have it here for the board's approval today.
Thanks, Alex.
Yes, sir.
Bring it to the board for questions or action then. Motion to approve. Do we have a second? And a second. Any further discussion on the motion? Hearing none, all in favor signify with an aye. Aye. Motion passes. Thanks, Alex. Number 3, request approval of health insurance renewals. Rick, good morning.
Good morning.
You're a man that does not need introduction, but you could just introduce yourself.
Rick Mitchum, I'm the employee benefit consultant for the city of Crown Point, probably for the last 10 or 12 years or so. your health plan renewal is coming up for January 1, 2026. Just got a quick handout there that you all probably have. This was a tougher renewal than the past. Loss ratios for 2023 were actually 493% loss ratio. 2024 was at 67%, which is not bad. And this year, year to date, we're running at 120% loss ratio, and that's expected to mature up to 137%. So a 3-year loss ratio of about 220% non-mature. We sent it out to market hard, as we always do. Went out to about 20 carriers. We only had one carrier to even offer a renewal proposal, and that's your incumbent carrier. All others, it was just previous loss history and ongoing large claims. The kind of good news is your worst year is the 2023. We had a 493% loss ratio, and sort of like workers' comp, but not exactly, because workers' comp, that third year falls off, and then it's just gone like it never happened. Once this one falls off, it holds very little weight. Okay, it's still there, but it just doesn't hold much weight. So I think we were very successful. We went back to the incumbent carrier. They gave us an original proposal that we didn't like very much, and we actually went back and got 4 separate revisions to get it down. And then on this first page, past the cover, I'll kind of give it away. You can see this is your historical medical trends that we've delivered in the past. If you go over to 2026, the last blue column, we're going to be coming in at about an 8.8% increase. This does exclude lasers, and your 6-year average is just a little under 2%. So, all in all, very, very good. The next page gets into the detail. Okay. If you look at what I've done here, I put the 2024 plan year in a very light gray column. And then the 2025 year that's expiring in the little darker shade of gray. If you just follow that all the way down to the bottom, just above where it says Samaritan Fund Program, that's where you see last year we came in at a negative 1%. And just staying right on that line, moving just next door in the bottom of the yellow column, we've got option 1, that would be an 8.4% increase. And option 2, which would be an 8.8% increase. And I'm actually recommending the option 2 because we're going to save a lot of premium and may have to give some of that back up in claims, but we may not have to. So I'll kind of go back up and give you the detail to that. If you can look at option 1, the top section there, at the bottom you can see that we're getting a 20.6% increase on premium contract to contract. And that just means your $100,000 spec deductible. Okay. If you go over to the light green column right next to it, if we take on a $25,000 additional risk per participant, we'll have a 2.2% increase. So we'll be barely paying more premium than we were in 2025. Now, how that works, if you drop down to the bottom right-hand corner there, I'm showing that $180,331 of premium savings. Everybody kind of see that? Okay. So what will happen there at the $25,000 additional spec deductible, you'd have to have 7 new large claimants to go between over 100,000 up to 125,000 before you'd give back that $180,000 premium savings. So to me, it seems to make good sense to accept option number 2. When you look at the summary of costs, and I can go into much details if you want, but if you look at the summary of costs across there, you can see in 2025, do you see, and this is just a fixed cost. This is the admin fees and the premiums. Okay. Last year or this year expiring as $1,164,000. If we go with option 1 and we keep the same $100,000 spec deductible, it goes to $1,376,000. But if we do take advantage of that premium savings and take a little extra on the spec deductible, it's $1,195,000. Okay. And then dropping down to the very bottom, you see the maximum over on the left, second kind of line up from the line items where it says maximum cost fixed versus maximum claims. You can see expiring year is about 6.3 almost $1 million. We are getting an increase on the claims exposure, the attachment factors. So that would go up to about 6.7 million and $6.8 million total on max cost, not counting, lasers. Okay. Down at the very bottom left, you can see where we're talking about large claimant lasers in 2024, 2025, 2026. The amount of lasers from 24 and 26 are virtually the same. But what's different there is you see the Samaritan Fund program. Earlier this year, we brought to the city a contract with the Samaritan Fund program, which was accepted and put in place. And what the Samaritan Fund program does, and we've already submitted information for 6 of the 7 people that's considered known large claimants. And they're starting to go through the process to see if they can find a solution with the Affordable Care Act marketplace policies. If they can, the Samaritan Fund program has a 501c3 trust called the Samaritan Fund Trust. And if they find an acceptable program for these claimants and families, then the Samaritan Fund Trust actually drops on a debit card, full annual premium for that person, full deductible, full out of pocket. They also will put in some travel expense money because a lot of them have to do a little travel for care, and then put a little extra on just to help with, unexpected stuff, I guess. So this year, we're hoping to mitigate those lasers. And the other thing underneath the Samaritan Fund program is we are seeking a direct contract with Rush University Medical Center. That we'd get a nice discount with Cigna, about 50%. But we're actually trying to get a direct contract that would be Medicare plus a little bit, which would save some money. So we're pursuing that. And for that particular participant, we're pursuing the Samaritan Fund program and the direct contract simultaneously just to mitigate your cost. So I'd recommend renewing at option 2, save the $180,000. Not likely to have 7 new claimants go over $100,000.
So if we did option 2, then the overall is 8.8.
8.8%, yes.
So I know, like on here, we have the graphics for the past 6 years.
Right.
But is it when insurance companies, when you're putting it out, do they look at 6 years or do they look at like the last 3?
No, really, they look at the last 3. This is just for, I just keep this data in my, and I just share it.
Yeah, no, it's great information comparison.
But yeah, they really look at the last 3, and the third year is not near as important.
Yeah.
So once we look at next year's renewal, the really bad 493 loss ratio will be included, but not very credible.
Right. Karen, Katie, HR, anything to add there?
Well, we're just thankful for Rick and his due diligence, and we're thankful for the Samaritan Fund. I think it's going to save us this year.
Yeah, I agree. So I'll bring it to the board for questions of Rick. Like you said, it's been a challenging, not only this renewal process, but the last few years for the city, based on what he's able to negotiate for us and working with Karen and Katie, staff. We've previously discussed, I think, the option 2 is the one I would recommend. That's one Rick is recommending. He's never steered us wrong. But I'll bring it to the board for any questions. So would the appropriate, what do you need today from the board?
Just need approval to adopt option number 2. And then we have a quick signature for the PBA admin renewal.
Okay, so you need a board to approve the renewal plan that you
Right.
present. Okay.
Question for you, Mayor,
Yes.
if you're ready for a question.
Sure.
he says a lot of things that I'm really not familiar with it, but I know you've been working on this and
Yes.
sometimes you can relay in terms that I can understand. Now, you've been working on this and now this is just for this year.
It'd be for 2026.
2026, that's what we're doing this year. We generally do this time of year, don't we?
Yeah, because it takes effect.
Yeah, we try to actually get into the second Board of Work meeting in October. Because of the challenging and underwriting and negotiating, we had to push it back to this first meeting in November.
So we're gonna be good for 26.
Correct.
We're good for the rest of the year. 26, we're gonna be good, then we'll be doing this next year.
Correct, it's a year to
You'll
year,
Come back,
yeah, year to
and
year.
evidently you approve of this or we wouldn't have got it.
Yeah, I mean, as Rick said, this has been a challenging one for him, but.
To me too.
So, but through the hard work, this is, and the Samaritan Fund, which is really been, has a very good potential for our employees as another option.
Yeah, I will say, the one little challenging thing about the Samaritan Fund program with your particular location is a lot of the ACA plans are state, there's definitely state by state. Some of them, have the lines in Indiana and like Rush University, I mentioned that it was not part of any of the ACA plans in 2025. So that was not a fit for that participant because that's where they go. So that's why we're pursuing a direct contract on that. Lurie's another big hospital, Lurie's Children. A few of these people go there. Lurie was with Aetna last year in the ACA plan. We're hoping that they're still part of that, in which case that should be a good fit for them. And then a number of them use the University of Chicago. We're hopeful that that'll be a good fit network wise, because you've got the University of Chicago right here in Crown Point. We hope that would carry right over to the University of Chicago campus in Chicago.
Mayor, I don't have all the questions I got. I'll support this because I know that you worked on this very hard and I can make a motion for that if we're still in the questions. So, but when we do for the motion, I'll make it.
Is there any other questions for Rick? Okay, and the appropriate motion would be just a motion to
Yes,
approve the renewals as presented.
as presented.
So we have a motion to approve the renewal. We have a second. And a second. Any further discussion on the motion? Hearing none, all in favor, signify with an eye. Aye. Opposed?
Thank you very much. Appreciate it.
Karen Gage, good job too.
Might want to add option 2 to that approval versus option 1, because option 2 is what Rick had suggested.
State.
There's 2 options here.
Clarify it, so
Yeah.
Bob wants to
I will.
motion
Approve renewal option 2.
to approve renewal option 2. Second. Yep. Second has none. Sorry, for option 3. Okay.
Yes.
Bob amends his motion.
I will.
I'll amend my motion. Amend the second. So let's take a revote to ensure that we clarify.
Okay, so the correct motion that you're voting on is renewal option 2 as presented.
As presented.
Okay,
Yes.
All in favor, signify with an eye.
Aye.
Aye. Opposed? Motion
Thank you all very much.
All right, thanks, Rick. Number 4, request approval of mobile integrated health agreement with Franciscan Health. Chief?
Thank you, Mayor and Board. You have 2 agreements that kind of are together as a program. First one's an MIH agreement. This solidifies a formal program relationship between us and Franciscan Health Crown Point for them to, when they discharge patients from the hospital that fits the criteria for our MIH program that live in the city, we would work directly with the hospital, work with those patients before they even come out of or discharged from the hospital. Currently, the MIH, we mostly just get referrals from our EMS crews that go to calls or patients that we have repeat calls to. So this will add another pathway into the program. It's not a funded program yet, but we're hoping kind of this is the next step to get there. So with our program still being primarily grant funded, we made sure there was language in the contract where it allowed us to terminate the contract if we would lose that grant fund.
Is this for a 1-year period, the proposed agreement, or is it?
It's indefinitely just yeah, there's no time for now, but it allows us to get a 30-day notice.
Okay.
The program or the relationship. So that's the MIH agreement. And the second one is the healthcare coordination agreement. All that is it's a security agreement with Franciscan, because with that program, our MIH people will have access to the Epic, their healthcare computer system, to be able to get patient records and kind of work closely with doctors and all that. In order for them to get that access, we as a city have to agree to their security.
Yeah. So, I mean, you and I have had a lot of talks, but the program itself, since its inception, has really been a
It's
fantastic
been
tool
overwhelming.
for the community, right?
Yeah, we got nothing but great feedback from not only the patients, but the family. A lot of families just are stuck with not really knowing what resources are out there. And every situation is different. So we've been building over the last year, literally a book of resources. So depending on what the situation is, we can, if it's not our department directly helping them, we've got a lot of different resources we can link them to. So it's been nothing but success stories. So
Yep.
Good program.
Okay, thanks, Chief. Alex, legal okay with that? All right, we'll bring it to the board then for questions of the chief or action on the proposed agreement.
So moved, Mayor, as presented. That's the only question I have.
A motion to approve the agreement. Do we have a second?
No second.
And a second. Any further discussion on the motion? Hearing none, all in favor signify with an eye. Aye. Aye. Opposed? Thanks, Chief.
Thank you.
Number 5, request approval of 2025 Lamar advertising contract. Mary.
Good almost afternoon. I'm requesting that the communications department renew our advertising agreement with Lamar. It's a 6-week agreement that starts in mid-November and goes through late December, promoting all of the city's winter events. This contract was very successful last year. We saw all of our ads all across the city at 6 locations, highly trafficked spots along 109th Avenue and Broadway. The only difference in the contract this year is a $60 increase, which I think is fair and equitable. Alex reviewed the contracts and approved them, and the funding comes from my advertising budget. I'm not asking you for any money.
Okay, thanks, Mary. Alex?
Yeah, I'll get there.
Okay, we'll bring this in to the board for any questions of Mary or action. I'm sorry, Bob, was that a?
So move on that.
We have a motion to approve the contract. We have a second and a second. Any further discussion on the motion? Hearing none, all in favor signify with an eye.
Aye.
Aye. Opposed? Passes. Set with that one.
Awesome.
Next up, request approval of 2026 golf now.
This is our annual renewal with Golf Now. It's a local golf publication that's distributed all over Indiana and the Chicagoland area. We have a full page ad in it every year. The price is the same at $2,995. We use the space to promote our coming year's events. So we'll use our space next year to promote our 2026 events. This is paid out of the tourism fund.
Okay, thanks, Mary. Alex?
Yeah, there's same contract we use with Golf Now for several years, so no.
Bring it to the board. We have a motion to approve the 2026 contract.
Yes, sir, as presented.
And do we have a second?
A second.
And a second. Any further discussion on the motion? Hearing none, all in favor signify with an eye. Aye. Opposed? Motion. All set.
Thank you.
Great job, Mary. Thank you. Number 7, request approval of the 2026 contract with Healthy Access. Karen?
Yes, it's exactly the same contract as the 25, no rate increase, so they do a great job for us. They actually expanded for us like they had promised, so everything's good. The clinic saves us probably about $500,000 a year in office visits, lab work, x-rays and medications. I mean, I think the employees really utilize it and enjoy having the clinic.
Yeah, I agree. I can't say enough positive things about the staff down at Healthy Access. Alex,
Mayor, is ready for action.
we'll bring this to the board for action and questions. Karen?
So move.
Motion to approve the contract and a second. Any further discussion on the motion? Hearing none, all in favor, signify with an eye. Aye. Opposed? Motion passes. Thanks, Karen.
Thank you.
Number 8, request approval for the Kids New Year's Eve activities event. Diana?
Hello. So this year, we're looking at making a few changes to our Kids New Year's Eve event. We'd like to move it to Bulldog Park and add the activities just to open skate. So we'll have a magician available, the balloon artist, a DJ, and face painter. Those will just be included in the open skate price.
Okay.
So these are the 3 contracts for the DJ, the magician, balloon, and face painting.
Okay, and it's noon to 4?
Noon to 4, yes.
Alex?
Oh, yeah, Mayor, I think David H. reviewed those with Adam, and I think those are good to go unless Dave's got a comment on them.
All right. So bring this to the board for action and with questions of Diana. It's for the Kids New Year's Eve.
So move.
Okay, we have a motion to approve the agreements. Do we have a second? And a second. Any further discussion on the motion? Hearing none, all in favor signify with an eye. Aye. Opposed? Motion passes.
Thank you.
Thanks, Diana. Number 9, request approval of Sarman Pond Maintenance Agreement. Jenny Burgess.
Mayor, I am asking for this item to be deferred. I am waiting on some additional pricing. And when I got back, I'm trying to put it together in an apples and apples thing with both companies to make sure it's the same. So if we can defer to next meeting, I would appreciate it.
Okay, yep, we can do that. So we need a board to approve the defer request.
So move.
Motion to defer, Bob second. Any further discussion on the motion? Hearing none, all in favor signify with an eye. Aye. Opposed? Motion passes.
Thank you.
Number 10, request approval to purchase Towmaster trailer. Terry.
Thank you, Mayor. Good morning, Board. I come before the board to get permission to purchase a Towmaster trailer from McCann for the price of $15,754. It's a Sourcewell purchase, meaning that's the best possible price we could get. And it's usually used for the Bobcat to move it around town, but that trailer is no longer roadworthy. It can no longer be repaired, needs to be replaced, and can be paid for by motor vehicle funds.
Okay. It's only a trailer. I mean, do they have them in stock or is it?
It'll be here second week in January.
Okay. Okay, and the amount is $15,754.
Yes, sir.
Okay. Okay, we'll bring this then to the board for questions of Terry or action.
So move, Mayor. I don't have any questions. We discussed this some time ago.
The existing trailer is shot. so
Yeah,
we-
it's over 20 years old.
We got our money.
Yeah, we sure did. There's nothing left to weld to. It's done. It shouldn't even be on the road. It's used for a lot more than just a Bobcat. We haul other equipment and things around for special events and different things.
So I had a motion in a second. Okay, any further discussion on the motion? Hearing none, all in favor, signify with an eye. Aye. Opposed? Motion passes. Next up, request approval to purchase 2025 F-450 truck. Terry?
I come before the board to get permission to purchase a 2025 F-450 truck from Curry Ford. The amount of $126,917. It does have its Sourcewell discount of $3,588. The truck, we were fortunate to find one. They're actually building it, and we should have it the second week in November, which is really unusual. And it'll be greatly used.
So it's a Sourcewell price,
Mhm.
so it's the 126,917
Mhm.
plus the cost for the chassis, or is that part of the one?
That's all one package, the two things, the chassis 655, and then the other components are 66,850
Okay,
for the snow fighter components and plow and salt spreader.
what's the, for everything to be included, what's the total price?
$126,917.
Okay, so bring this then to the board for, is this a replacement? Terry?
I think we're gonna use it for truck 52. It'll be
Did we get rid
replaced
of
with
that?
a 1-ton. It was an old 4-ton 52 was, that
We
hasn't been
don't have that
replaced.
anymore, right?
It's gone, but we never replaced it, so
Okay.
this will be its
So
replacement.
this is a replacement. Okay,
Will it be this year? I mean, as far as we're gonna.
It'll be
We're tech
Jan,
possession this year?
this one, yeah, it'll probably be here second week in November. They're building it as we speak, which we were lucky to catch it because there's two of them, they would have been gone. So we managed to secure one.
okay, so we have a motion to approve the purchase request. And a second, any further discussion on the motion? Hearing none, all in favor signify with an eye. Aye. Opposed? Motion passes. And number 12, request approval to purchase 2026 Peterson Lightning Knuckle Boom Mower.
Okay, I come before the board to request permission to purchase a 2026 Peterson lightning loader, say that fast, for $188,712. This is a Sourcewell price. We are trading in our old knuckle boom, which is, they're giving us $17,841.68, which is a 2007. The issue with it, that truck seemed to be down more than using it, and the parts are very scarce. So this truck is a vital piece of equipment, especially when we get a storm, because sometimes that truck will go 2 weeks and not shut off. It'll just be constantly running. So we feel it's time to get rid of it and purchase a new one.
All right, and the vendor's Best Equipment Company.
Yes, sir.
Okay, and it's a Sourcewell price. You said.
Yes, sir.
Okay. So bring this to the board then. This is a replacement one for our one that's 16 years old, more than that, 18 years old. Is that a motion to approve?
Yes.
that? Okay, we have a motion to approve the purchase request. We have a second. Second, any further discussion on the motion? Hearing none, all in favor signify with an eye. Aye. Opposed? Passes. And number 13, request approval to purchase a 2020 John Deere loader.
Thank you, Mayor. I come before you to purchase this 2020 John Deere 544 loader, which has 5,630 hours on it. We'll be trading in our smaller sludge loader that doesn't even run, and our loader that we used in the salt barn, which basically is just going to get sold off for parts. They're giving us $15,000 for both of those, which brings the price to $97,000. We were fortunate enough to have Harding's drop the loader here last week, and the guy's been running around using it. The thing is pristine. We purchased a lawnmower during the summer. This came from Fair Oaks Farms. They lease all their equipment, and they're all about show. So every couple of years they get rid of it. This thing is actually in nicer shape than some of our loaders that we have. And it's got which is going to help. We're going to put this in the sludge. It's got extended arms because we've always had issues in the past. When they load the trucks, they come up short and it's got the extended arm. So it'll be a little more centered and we won't have a big mess. Then we're gonna take the sludge loader that they're using presently and make that the salt loader.
Okay. And the total price is 97,000.
Yes, sir.
Okay. Okay, I'll bring that to the board then for action or questions.
So move.
Okay, we have a motion to approve the purchase request. We have a second
Second.
and a second. Any further discussion on the motion? Hearing none, all in favor, signify with an eye.
Aye.
Opposed? Motion passes. Thank you, Terry.
Thank you, Mayor. Thank you, board.
Number 14, request approval to release maintenance bond for Sawgrass Phase 1. Doug Bray.
Thank you, Mayor. Ask the board to approve the release of the maintenance bond for Sawgrass Phase 1 in the amount of $191,560.39. All the work has been completed and inspected, so we're ready.
Okay, thanks, Doug. We'll bring this to the board.
So move.
A second. A motion and a second for approval. Any further discussion? Motion. Hearing none, all in favor, signify with an eye. Aye. Opposed? Motion passes. Thanks, Doug.
Thank you, Mayor. Thank you, board.
Karen, you have something?
I do have some, because there was a little bit of cleanup and confusion about, because Rick had said earlier in the motion, we made the motion to approve all the insurance renewals, and that included PBA's contract. Then the second motion was the second plan. It did not include PBA's contract also, which is our plan administrator that pays our claims. So do we have to do that separately? Will we add PBA into the second motion, or what do we need to do? I did sign the contract as Rick left.
So our motion only included option 2 and did not include PBA.
Yeah, the first one included PBA.
Okay, so why don't we just go back to that line item? Get a motion to approve, a
PBA.
motion to approve PBA's contract.
Also.
Separate motion.
Separate motion.
So this is, the PVA contract is Rick's contract.
No, that's not Rick's
Or,
contract.
yeah.
It's our plan administrator that plays our claims.
So we're gonna do one motion on just that.
That's correct, yes.
I'll make the motion.
Okay, you have a motion to approve it. Second. Any further discussion? Hearing none, all in favor, signify with an eye. Aye. Opposed?
Thank you. Sorry about the confusion.
No,
I
not at
just
all.
want to be safe and sorry. but we had it.
Okay, our next scheduled meeting will be Wednesday, November 19th at 11 a.m. and we need a motion to adjourn.
So move.
Motion, second. Any further discussion?